Well, hey guys, in today's video, I'm going to be talking about doxycycline for acne. I've gotten a lot of requests to talk about doxycycline because it's a medication that we commonly use to treat acne. What is doxycycline? It's actually an antibiotic in the family of antibiotics called tetracyclines. It's used to treat a variety of different bacterial diseases and acne. And it works for acne by doing a few things. Acne is a disease of a few different factors. First of all, you have bacteria in the pore called Cutibacterium acnes. You also have a lot of oiliness that directly feeds that bacteria, and you have inflammation. Doxycycline, an antibiotic, works to treat acne by lowering the amount of Cutibacterium acnes and suppressing the levels of inflammation. Doxycycline works by reducing the recruitment of inflammatory cells and inflammatory mediators to the skin. Doxycycline is not going to be a treatment for all types of acne. We only use doxycycline or any antibiotic to treat acne when it is moderate to severe. What does that mean? Well, it's pretty inflammatory and you see a lot of redness, patient has discomfort, a lot of cysts. Those types of lesions, if untreated, will go on to form scars. So antibiotics are great because they calm down that inflammation and reduce the bacteria, leading to clearance of those inflammatory acne lesions and preventing scarring. However, antibiotics are not appropriate for acne that is mild, not inflammatory. If you have acne that is mostly blackheads, whiteheads, the medical term for those are open and closed comedones, antibiotics are not appropriate for that. So we don't just use them for everyone, only right for certain patients. Now, doxycycline is not the only antibiotic that we use to treat acne. We also use another antibiotic in the tetracycline class called minocycline. And if you'd like, I can do a separate video on minocycline for acne. But doxycycline is one that we use and it is very effective. But it's important to understand that it is not a long-term treatment. Because it's an antibiotic, there are risks associated with using it, namely bacterial resistance. And what I mean by that is that Cutibacterium acnes, the little bacteria on your skin, it can become resistant to it. Also, other bacteria on your skin and in your gut can develop resistance to that antibiotic. So we don't use it indefinitely. We try and restrict use of oral antibiotics for no more than 3 to 4 months at a time. And so you should be aware of that. The reason we use it is to clear up the inflammatory stuff that you have more quickly to prevent scarring. But the goal is that other topicals, which take a long time to start working, can be started maybe at the same time. And those are going to take over and be what control the acne long term. Because doxycycline works to reduce both the bacteria on the skin as well as inflammation, it works pretty fast and pretty effectively to reduce those inflammatory, painful acne lesions and then subsequently prevent scarring. Doxycycline is available by prescription only, so you need to go to your dermatologist and discuss if this is right for your acne. If you have the right type of acne, that would be amenable to treatment with doxycycline and worth it. The dosage varies a little bit. Everybody prescribes kind of a different dose for different patients, anywhere from 50 to 100 milligrams, either once a day or twice a day. And the duration is usually 6 to 8 weeks, but again, it may extend out to 3 to 4 months. Because there is a risk of bacterial resistance with using oral antibiotics, I always instruct my patients to use a topical medication or over-the-counter product that has benzoyl peroxide in it while they're on doxycycline or any other oral antibiotic. Benzoyl peroxide is antibacterial and anti-inflammatory, and using it in conjunction with oral antibiotics reduces the risk of bacterial resistance. Unfortunately, benzoyl peroxide can be very drying and irritating, but even at low percentage strengths, 2.5 for example, you can get reduction in bacteria, reduction in inflammation, and you can get reduction in the risk of bacterial resistance to the oral antibiotics. And you can get that in a wash form. So a wash form at a lower percentage strength tends to be less irritating than those higher percentage strengths that you leave on the skin. So that's what I always recommend, and many dermatologists do as well. What are the side effects of doxycycline? Probably the most common side effect is nausea. I always tell patients to make sure that they take the medication with a full glass of water. Some people who are really sensitive, maybe have a really sensitive stomach, they may even have vomiting. And the other major gastrointestinal risk with doxycycline is that it can cause a pretty bad heartburn, actually something called pill esophagitis. Basically, the pill can be very, very irritating to the lining of your esophagus. So I always advise patients to make sure that they take the medication and remain upright for at least 30 minutes, but ideally an hour. You don't want to take this pill and then lie down, because the pill can reflux and get stuck in your esophagus and cause a really, really, really bad heartburn. So you always want to make sure that you take it with a full glass of water and remain upright. Beyond the gastrointestinal side effects, nausea, rarely vomiting, and then the risk of esophagitis, the other risk with doxycycline is that it's going to make your skin more sensitive to the sun. So you have to be very, very careful to protect your skin from the sun, wearing sunscreen and not staying out too long, wearing hats, etc. You're at a higher risk for burning on doxycycline. And you should be protecting your skin from the sun anyway, but it's really, really important while you're on this medication. Because antibiotics can disrupt our natural microbiome, our natural gut flora, we can become more disposed to yeast infections as a result. So vaginal yeast infections or thrush are more likely when you're on oral antibiotics. And then lastly, doxycycline is not safe in pregnancy or breastfeeding, so it's not appropriate in those situations either. If you have been prescribed doxycycline, do know it is very safe and effective for the treatment of acne. We've been using it for decades, and side effects are very rare actually, the most common being the nausea. But also remember that doxycycline is not going to cure your acne or be a long-term solution. It's really meant to urgently get in there and clean up those inflammatory lesions that could go on to scar. And there's going to be another medication that you likely will be on more long-term that will control the acne. As with anything in the skin, it can take a little bit of time for the doxycycline to start working, so don't expect to take one pill and magically have clear skin the next day. It can take a few weeks, but generally speaking, oral antibiotics work very quickly to reduce the redness, the painful cystic acne, and to clear everything up. But remember, this is not a long-term solution for your acne. It's only meant to clear up those existing inflammatory lesions that would otherwise go on to form scars. It's basically used to prevent scarring. In the meantime, you'll be started on something else that is going to be used long-term to control the acne and will be safer without the risks of bacterial resistance. So that's everything I can tell you about doxycycline for the treatment of moderate to severe acne, and it's a very common treatment. Stay tuned, I will be doing another video on minocycline, a similar antibiotic for the treatment of acne. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.